Well, low back pain is not only common in the area, it's common all over the world really, and certainly in Western civilized countries. It's one of the most common things that people are seen by any medical professional for, second only to the common cold. We've seen a wide range of patients we do and historically have forever, ranging from young to old. There's not a specific demographic that we tend to see dominate, from young to old, big to little, flexible to stiff, fit to unfit. The risk factors for lower back pain are similar to those for other musculoskeletal problems, and those are general low levels of fitness. Even though I say we see both high and low levels, typically lower levels of fitness tend to be at greater risk. People that are physically active and regularly as part of their work or perhaps recreation can have a greater representation in the population of people that suffer back pain. That said, part of the treatment is always activity, so we never want people to think that being active is a bad thing. We want them to understand that being active is essential for good health, both for their back and for their body at large. Oftentimes it's activity related, but some of the most vexing stuff we deal with is not activity related. It's really unknown, and patients will relate that, and we'll take that as a history, but it's a mystery as to why they come in. Perhaps it's muscle strain or joint stress or strain or sprain. It can be any number of things, but they've come here and generally they get to us because that pain has persisted for a certain amount of time. Back pain is so ubiquitous. We understand that people experience this all the time. So what makes a difference in when they need care or not? That's the questions they ask themselves. And we say generally a one-time episode, we're not too worried about it, especially if it goes away or shows strong signs of completely abating within 3 to 5 days. If it lingers and doesn't show signs of going away within 5 or 7 days, that's when they need care, or if this is a recurrent condition. Those are the criteria under which we say you could use some help. When patients experience back pain, or in prevention of back pain, what we always advocate is general fitness. So walking is one of our favorite activities for both patients and people who are trying to not be patients. Gentle stretching and strengthening around the trunk, core musculature, that kind of thing are very important. The first thing we try to do is, well, we recognize that everyone is an individual. Well, we used to kind of lump everybody into low back pain. Everyone was the same, or it depended slightly on whether it seemed to be coming from your disc or from your joint or from a muscle. Now what we call subgroup people based on their story, their history, and based on the findings of our examination. With that, we put them into groups of treatment parameters that have been tested out in research in addition to that. So that's our first step. Second step is we look and see where the weakness or the tightness or the sensitivities exist, and then we address those tissues directly. The Department of Rehab Services here at Newton-Wellesley Hospital works with all the physicians. With low back pain, we work closely with the Spine Center and the Pain Center, but we work with all primary care physician offices and subspecialty medical offices. If you're having low back pain, contact your primary care physician. If you want to know more, go to www.nwh.org.